I'm so sorry that you're back. It's Dr. Garcia.
I remember you.
I'm sorry. You've had an ordeal with this.
Oh my God, it's terrible. I want over with.
Thank you very much for talking with my resident, Dr. Patel.
Mm-hmm.
We went over your case. We'll be keeping you.
Okay.
My understanding is pain definitely is getting worse and your imaging does not look great.
Mm-hmm.
So, I know you spoke to my surgeons earlier because they talked about how the appendix doesn't look very happy either.
Mm-hmm.
But I do want, and I know they kind of briefly talked about it with you.
Uh-huh.
You may be a case that just doesn't respond to medical treatment.
Yeah.
And this might be something where they actually need to remove part of the bowel to get this controlled.
Okay.
Is that something that, I'm not saying we have to do that tonight by any means, but I just want to kind of give you that thought.
What does that mean?
Basically, I don't know if the surgeon, Dr. Gore, talked to you at all kind of about what it is, but essentially they go in and they remove the part of the bowel that keeps getting super angry.
Okay.
Sometimes, depending on the setting, that can end up with the ostomy bag. That's the one where part of the bowel connects to the wall and you have the poop bag. Sometimes it does not require that. Okay, so it would be hard to say necessarily. But I'd like to start calming you down with some antibiotics. We'll get some stuff on for pain. We'll leave you alone tonight in terms of diet. You can do like ice chips if you want. But we'll try to do most everything with kind of IV and let you settle and then talk to surgery more in the morning. Because again, we definitely want to calm down a lot of the inflammation with IV antibiotics to even start with. And then give you the best idea for outcome for surgery after.
Silly question.
Yeah, no, not at all.
What's the difference between the antibiotics that I've been taking versus the ones tonight?
Nothing. I'm giving you the same stuff you got before. The thing is that you recover well when you're on the IV.
Uh-huh.
Our problem is when
Yeah.
you switch to oral that we get into trouble.
Okay.
So, I mean, even if we were to keep you for 2 weeks of IV antibiotics, I'm fairly convinced, given your history, that you're going to come right back up again with the same problem.
I'm afraid so.
So my concern is that we should get surgery involved early on to make sure that you at least have that option if you decide to do it and they're agreeable to doing it during this admission versus soon after you get discharged.
So what would be removed is
The part of the bowel that is angry.
okay, and it's out that where the abscess is.
Yeah, so that portion would be involved as well.
Okay. Do we know? Silly to ask, but
I don't know.
how much would be taken out? What?
It would have to be up to the surgeon. They would be able to give you a better number.
Okay.
But other than that, just something to kind of contemplate, but don't worry about tonight. We'll get the pain control, we'll get the antibiotics on board, and we'll do basically what we did last time, try to get, everything better and ideally see how you do in terms of starting diet and everything else like that. Have you had issues with vomiting?
Not this time.
Okay. It's just diarrhea this time? Okay. And then how about the constipation? I know last time you were having more constipation than diarrhea.
It's there, but I can't even explain it. I feel like I go, but once it's in the toilet, it turns into diarrhea.
Okay.
So it's not solid, but it's not soft.
Okay.
Yeah.
Okay. And how many episodes of diarrhea have you had?
Oh, I haven't stopped since I first got diagnosed.
Okay. Alrighty. And let's see. I think that's about all I have for you. I believe the Dr. Patel talked to you about your code status, the CPR.
Yes.
Okay. Full code on that one.
Mm-hmm.
Fantastic. All right, my
What
dear.
about the appendix? What are we doing with that?
Antibiotics.
Antibiotics.
Mhm.
Okay.
Yeah. When surgery saw you, they took a look at the imaging, took a look at your exam, and said no intervention for the appendix. I called them back and said you're perfectly welcome to say no to the appendix, but looking at how frequently you're having recurrence of the diverticulitis, you may need to have part of the bowel removed. And they said that they would kind of talk about it and likely get back to us in the morning. Okay, do you mind? Hopefully I will be the last person to push on your belly for this evening. Where does it feel the worst?
This time it's right in the middle.
Okay.
It's not
I think
so
last
much
time
on
it
the
was
side.
left
It was
lower
on the
quadrant,
left
right?
lower,
Yeah.
Yeah.
So it's
Now
right here at the belly
more,
button.
like right around here and a little bit on this side.
Okay, so a little bit more right sided. Okay. All right. I don't have to focus. You can just poke. That's fine. Enough people have poked. I have
Yes.
imaging. It's not going to change anything that I do. It's just going to make your pain worse. All right. And then any swelling or
No.
issues like that?
No.
Okay. Very good then. All right, my dear. We will get you upstairs as soon as we have a bed for you, okay?
Thank you.
My pleasure. And I wish you all the best.
Thank you very much.
I do hope that we can get this resolved for you.
Thank you.
All right, my dear. Thank you.